Keith is one of those rarities that has been the singular CEO of an organization for, well, since 1985, for roughly 27 years. And he's led us through tremendous change and growth. And throughout that, those periods, his constant message has always been one of listening to our community and ensuring that the services that we're adding or how we are expanding, that we are doing that in response to community need, because he is driven to ensure that it's a rarity that patients have to leave us to seek care elsewhere.
You know, through his years, Keith has recruited or had a hand in recruiting every physician we have. There's only, I think, 2 physicians that are here now that were here when he came. During that time, he's also been instrumental in expanding the hospital. We had a $50 million project about 10 years ago in which we brought radiation therapy to Bartow County, which we didn't have it before. Patients were having to drive to Marietta or Rome for that. They don't have to do that anymore. He's also instrumental in the current expansion, about $26 million expansion, which will almost double the size of our ER, add another floor to the hospital, and allow us to go 100% private rooms. So, I mean, those are 2 great things. I know the radiation therapy he worked on for many years through opposition and was able to bring that to fruition. So we hear from our patients countless examples of patients who used to have to drive and now they don't, and how excited they are about that.
He invites anyone in the hospital to speak with him about concerns they have or compliments they have. Anyone can come to his office and speak to him at any time about any concerns. And again, I hear lots of comments about that from staff, that what an amazing attribute it is to be able to go talk directly to the CEO. But probably what impresses me the most is any discussions that we have about the hospital, services we're going to provide. He always asks, okay, what is in this for the patient? Have we considered the patient?
You know, 29 years in one place is a hero in any profession. He could have gone anywhere he wanted to go. I know personally that he's had opportunities to leave within our company. He's been asked to go to other hospitals, and he said no.
I think he made a decision that he would try to raise his family here. He would be an essential part of this community. And rather than going from hospital to hospital as he moved up the ladder of responsibility, he decided that he would grow this hospital, grow this medical community, and it's been great for us because we've not had changes in personality, and we've had a person that we knew, that we liked, that we could depend on, and that's made all the difference.
The Keith Sandlin that you see in the community and that you talk with is the exact same one that you see behind closed doors and in the boardroom. And staff have really great opportunities to interact with him and to share their thoughts about where we're headed, both with that aligned vision, but also those things that we need to consider that sometimes we miss. And Keith recognizes that we're all greater because of who we are as a unified group: staff, medical staff, our volunteers, and of course our leadership team.
And I always think, when I see the word hero, I think of Keith, just because in every way he deserves it. Family, business, just the whole oversight of Keith is a hospital hero. And you can see that in what this hospital has become.
Thank you so much for recognition as a hospital hero for Georgia Hospital Association. I'm grateful and very humbled by this award, and appreciate the support of all my colleagues and all the healthcare professionals around the state of Georgia. Certainly I accept the award on behalf of all the staff of Cartersville Medical Center, the employees, medical staff, board and volunteers who do a terrific job every day, and they're the real heroes in this business, so I'd like to recognize them. And once again, I'd like to thank GHA for this honor.